So let me jump into it. I want to welcome you and just introduce myself. I'm Hannah Halbert. I am the director here at Policy Matters, Ohio. And if you know Policy Matters, we are your friendly neighborhood think tank. So we like to look at state policies to say, hey, how is this working for everyday working Ohioans? Does policy help make this state more equitable, more inclusive, more sustainable, more vibrant? Is this the kind of place where you really can make a go at it, right? So, uh, since that's our mission, you know that health insurance is top of our list this year. Health is the first wealth. And we are incredibly fortunate. Truly, as we were joining the call, I had to share that I was a little bit starstruck to have Vaishu Jawahar joining us. Vaishu is the Director of Policy Programs at Protect Our Care. Protect Our Care, really, I think of them as the experts, the folks leading this federal fight to make sure that quality healthcare is affordable, is available to each and every one of us. And just this is kind of the folks that like the experts are going to turn to get the inside scoop. So we are absolutely lucky to have Vaishu join us, especially on a day like today when we saw the vote that happened in the Senate. Okay, so again, Policy Matters. If you like what you hear tonight and you want to learn more about what we're doing, this is where to do it. Sign up for our Saturday Stats newsletter. We try to keep it as conversational and funny and engaging as possible. And we try not to bombard your email with a bunch of spam. So if you're interested in learning more about this kind of policy, engaging in these kinds of policy conversations, sign up to that newsletter. That way you can keep track of us without also participating in one of the social media conglomerates. So, all right, let's see. I want to talk a little bit about the Ohio context just before we hand it off to Vaishu. First, I want to just underscore the ACA has unquestionably helped Ohioans afford healthcare coverage, manage health conditions, access preventative care, decrease ER use, and those uncompensated cost of care costs for hospitals. How about that? And reduce medical debt. That's happened. That's in the data. HR 1, so the big bill that passed earlier this year, that many Ohioans were engaged in trying to slow down, to stop, to mitigate some of the harms in. HR 1 took aim directly at the programs that the ACA, the Affordable Care Act, put in place, cutting funding, enacting eligibility and administrative restrictions for accessing the marketplace plans, and attacking Medicaid expansion. Combined, these two ACA programs immediately decreased the numbers of Ohioans living without health insurance. So if you all remember back to the before times, 11% of Ohioans were uninsured, okay, 2013. That was cut nearly in half to 6.5% in 2015. Okay, that was an immediate impact, right? A before and after. And what we're experiencing now with the ACA is death by 1,000 cuts. The enhanced premium tax credits that were all in the news, these were put in place for the ACA Marketplace in 2021. These had decreased marketplace premiums by an average of $700 a year as of 2024. Marketplace enrollment more than doubled nationwide between 2021 and 2025, okay? So just like we saw an impact when the ACA rolled out, we saw Ohioans getting health insurance. When these tax credits were put into place, we also saw Ohioans, people nationwide, being able to enroll in the marketplace because plans were starting to be affordable. All right, next slide, Allie. And just for some context, it was already getting tough. I don't think this is a surprise to anyone. Many marketplace enrollees are already having tough times meeting healthcare costs, even with the credits in place, even with the premium protections in place. Next slide, please. And I also wanted to just give a little hat tip to a program we had earlier this year that talked about the importance of the ACA and benefits like SNAP to veterans in Ohio. There's so many people who are in this state who need and deserve and who have earned these programs that are squarely in target to have these basic necessities stripped. So I just wanted to highlight some of this. And if you have someone in your life, a veteran you know you love, there is some materials on our website to talk about the number and how these changes may impact veterans here. Next slide, please. All right. And then finally, why is this happening? It seems like such a backwards policy. Why are we having all of these cuts, all of these restrictions, this vast rollback of things that provided some basic level of economic security for people in Ohio and in the country? And we can't separate these program cuts from the tax cuts that also were enacted through the big beautiful bill HR1. And so I did want to provide some, just in your material, some information about those tax cuts. You can see that the vast majority of that benefit, 72% of the benefit of those federal cuts, is going to go up to the richest 20% of people in this country. Next slide, please. And the rest of us here are going to have to try to figure out how to make do and make ends meet. That's the same story of Ohio's budget. So whenever we look at the childcare crisis in this state, if we look at the cuts that are happening in public education around the state, we have to wonder, oh my gosh, why is this happening? Do we not have enough money? And there as well, whenever we pull back a little bit, we see we absolutely do have the money in this state and in this country to get this stuff done. Instead, we're spending it on tax cuts. And just like in the US, the way that Ohio has been cutting taxes is that it primarily, overwhelmingly benefits the richest slice of Ohioans. So here you see, since 2005, Ohio has adopted this sort of tax cut philosophy. The top 1% in this state are getting a tax cut of about $52,000 a year, while those in the middle may see $350, and those at the bottom, the people who are needing the most assistance, who are struggling to have the basics, on average, they're going to be paying about $80 more. So this backward system of taxes and revenue is driving a bunch of cuts across programs that were going to work for working people. Okay, next slide, Allie. There you go. Thank you all. I'm going to turn it over to Vaishu now so you get some in the nitty gritty about what's going on.
Great. Thanks so much, Hannah. And thanks to Policy Matters Ohio for everything that they do and for having me and for organizing this. Their staff are super great, and I really appreciate them letting me have this time here. So I'm going to do my best to explain what's going on as a result of this big ugly bill, as a result of these cuts to healthcare. They're the largest cuts to healthcare in American history. And it's important that people realize how that's going to play out on the ground, how it's affecting them when they log into healthcare.gov, and what you can do about it. So with that, let's get into it. My name is Vaishu Jawahar, and I'm Director of Policy Programs at Protect Our Care. Protect Our Care has been around since 2016, fighting the good fight and helping protect people's health care. And I've been working in healthcare policy in the federal healthcare policy space for 7 years. So I've seen some of the biggest gains in healthcare and most recently some of the biggest losses. So with that, let's get into the next slide. Okay, our agenda for today. So, number one for our agenda is understanding how we got here. How did this premium disaster come to be? Why are your premiums doubling and tripling? It seems like nonsense, and honestly, it's because it is. But we're going to explain how we got here. Then we're going to talk about what you're seeing when you log on to healthcare.gov, how you can navigate those price hikes, what to look for and prioritize. And then lastly, but definitely not least, how to make your voice heard, and how you can fight to make healthcare more affordable. All right, so if we're going to talk about why everyone's seeing all these marketplace premiums go through the roof, I think we should start out back to the basics. So, like, how did this marketplace come to be? What is the ACA? And then how did we move past the ACA and then end up here? So, the Affordable Care Act, as we all know, was a law passed in 2010, and it did a bunch of great things for everyone. Like, before the Affordable Care Act, if you had a pre-existing condition like diabetes or cancer, or my mom who has epilepsy, you could be denied insurance coverage. Even being a woman was considered a pre-existing condition, and insurers were allowed to charge you more for your health care because of it. So thankfully, because of the ACA, we don't have that happening, and we're seeing lots of folks with cancer and other conditions being able to get the health care they need. And because the ACA established these marketplaces across different states and through healthcare.gov, it created the first way for people who don't get affordable coverage through work or don't qualify for Medicaid, don't qualify for Medicare, for them to be able to access affordable health insurance and get tax credits to help them afford it. So it's been a huge source for small business owners, self-employed people, people who are contractors, and people who are artists, and all different kinds of folks, or people who work in the service industry and aren't offered health insurance through their employer, for them to get health insurance. So it's been hugely important. And since the ACA went into effect, it's helped more than 50 million Americans gain coverage. And I also just want to point out that over 100 million Americans have a pre-existing condition. So all those people are also benefiting from the ACA. On top of that, the ACA expanded Medicaid. So far, it's expanded Medicaid in 40 out of 50 states, including Ohio. Cheers to that. And Medicaid covers 1 in 5 Americans. And the vast majority of Medicaid recipients are also hardworking people. And so we just have to keep in mind everything that the ACA has done. And, it's Protect Our Care's personal favorite because we're really here to protect it. Another thing, the great thing the ACA did is it required insurers to cover preventative services. So now folks can get the mammograms that they need, the vaccines that they need, wellness visits, all without having to pay any copay. And that's thanks to the ACA. So just a few things to keep in mind when we're talking about how we got here. So we talked about earlier, the marketplace established this website for people to go to and be able to get health plans that were very comprehensive health plans, gave them all the healthcare access that they needed, and for lower costs, because 90% of the people who log onto the marketplace qualify for tax credits. And so it's helping a lot of people save money, and we see the effects in this graph right here. I know Hannah had the same chart as well. I think it's a favorite of all of ours. And here you can see 2013 was before the ACA went into effect. So within 2 years, you can look at like the amount of people with health insurance through the ACA, it doubled. And so like 10 million people got health insurance through the ACA immediately right off the bat. And then we can see when there was a change in an administration, and this administration did everything that they could to kick people off their health insurance, that the enrollment declined. And then we have COVID strikes in 2020, and Congress decides to expand the tax credits because now people need healthcare more than ever, considering the pandemic. So in 2021, with the American Rescue Plan, these tax credits were expanded, and these tax credits were expanded so that anyone, regardless of income level, you would not have to pay more than 8.5% of your income tops for comprehensive coverage. So it was a big deal because you shouldn't be paying as much as you pay for rent for your health insurance. So that was what was kept in mind. And these tax credits were not only expanded to more people, but low-income Americans could get their coverage for cheaper at a time that they really needed that help. And so you see enrollment double again. And now we're seeing it go from like 12 million, 13 million to 25 million. And so this was when enrollment hit its peak, was after these tax credits were expanded. And also you can look at the rate of uninsurance in our country declined. And I know this point isn't shown, but in 2024, we reached the lowest level of uninsured in our country, 8%. Our country had never had there was never a time before in our history where only 8% of Americans were uninsured. And that's because these tax credits were expanded. And so it obviously worked. It was a huge boon for people. And at a time when healthcare costs only kept going up, this was really necessary to save people and make sure that they could have access to the life-saving care that they need. This tax credit, it's not a whim. It's not for someone to get a Miata. It's for someone to get chemotherapy. Like it's absolutely necessary. But here's how we got to where we are now. Congress created a crisis by prioritizing tax breaks for billionaires over healthcare. So now when those tax credits got extended, they were extended until the end of this year. And that's because that's how much Congress could afford to at the time with the IRA. Their goal was to make it budget neutral, and they succeeded. So they were generating all of these savings by locking down on corporations and things like that. And they wanted to spend that money in ways that would be helpful for the American people. And they realized that they had the money to extend these tax credits for 3 years. And so they did that. Now we have a change in administration, a change in leadership, a change in priorities, and they decided to prioritize tax breaks for billionaires over healthcare. They decided to extend and make permanent tax breaks for billionaire donors, yacht owners, corporations. And to help pay for that, which by the way, they didn't even fully pay for it, they still added trillions of dollars to our deficit and gave trillions of tax breaks to the rich that they did not need to do that. They could have let that expire. But no, instead of extending these tax credits that are providing crucial health care to working families, they decided extending tax breaks for the rich are more important. We're going to do that. And we're going to let these tax credits that are helping 20 million people afford healthcare, we're going to let those expire. So this bill, the big ugly bill, I like to call it, but folks call it HR 1, it enacted the largest cuts to healthcare in the history of our country. It cut over $1 trillion from Medicaid and the Affordable Care Act. It absolutely gutted these tax credits by returning them back to their original levels way before we saw enrollment go up, way before we saw uninsured rates go down. And it's doubling premiums for over 20 million Americans who buy health insurance on their own. And overall, it's estimated within the next 10 years, it's going to rip away health coverage from 15 million people when all is said and done, simply to give tax breaks to billionaires. So it created this entire crisis that didn't need to happen. Congress simply could have decided to let tax breaks for the rich expire, but no, they didn't. And sadly, working families are paying the price. So the next slide, the ripple effect. So the effect that we're seeing on working families versus how it's affecting corporations and billionaire donors. Small business owners, older Americans, and working families, these are some of the groups who are buying health insurance on their own through the marketplace the most. And they are going to pay an average of $1,000 more each year for health insurance. And we've learned that more than half of our Americans now are living paycheck to paycheck. And this rate of inflation is no joke. So in this economy, we know that no one can afford that premium hike. On top of that, all these cuts to healthcare are going to affect rural hospitals and clinics. We're already starting to see them shutter. On Protect Our Care's project, the Hospital Crisis Watch, we have tracked over 600 facilities. 600 healthcare facilities are now at risk of closing or have made cuts, have closed wards, or announced that they're closing since the passage of this bill. And this is going to affect everyone. Even if you're not getting your health insurance on the marketplace, even if you're not getting your health insurance through Medicaid, you're going to end up paying higher costs because when someone shows up in the ER because they don't have health insurance, and also their bill's going to be higher because they didn't get care early and when they needed to. So now they're going to need surgery or something more expensive. Um, those costs will get passed on to everyone else because for a hospital, that's uncompensated care. So they have to pass on those healthcare costs in your bills and also in your premiums. So on average, people are going to pay about $500 extra in premiums because so many people are losing health insurance. Also, when hospitals close, costs go up at nearby facilities. One University of Minnesota study found that hospital prices for a stay will go up by an average of $500 when a nearby hospital closes. So it's really going to affect you regardless of whether you get your health insurance on the marketplace or not. And again, grounding this all in how we got here. While that's happening to working families, here's what's happening to corporations and billionaire donors. They're getting even bigger tax breaks. And unlike the tax cuts that are going to middle class families, these tax breaks are permanent. You'll notice that the tax cuts that are going to middle class families from that bill, they have a shorter expiration date. But those tax breaks that they're giving to the rich, to millionaires and billionaires, those will go on forever. They'll cost this country money forever. Rich kids in particular, they're going to get even more inheritance because now they're going to get it tax free. They've raised the level at which the tax kicks in for estate taxes and gift taxes. So now these kids will get even more inheritance. And that measure, by the way, to extend the tax breaks for estate tax, the exemption for estate tax and gift tax, that cost our country $200 billion. Guess how much it would cost to extend these healthcare tax credits for working families for just 3 years? $83 billion. So when Republicans say we don't have the money, sadly, that's very questionable because we decided we did have money for this, but we don't have money for healthcare for working families. And also another thing, foreign-owned companies will get bigger tax breaks and their tax breaks will also be made permanent. So these are all things that are happening at the same time. This is the price that we're paying. This is why we're paying it. Thank you. And here are just two resources showing, again, this is very similar to what Hannah showed us, that again, this is nothing in this bill will truly benefit the average American. And I think we can skip to the next slide since Hannah did a great job taking us through this. Here, this was a great resource from the Americans for Tax Fairness group. And here you can see the medium tax cut that some of these middle class families are getting because of HR1. And let's look at how much their premiums are actually going to go up because of HR1. Let's look at Ohio right there. Yeah, these premium hikes vastly outweigh any tax cut these families are going to be getting. So this is the reality of the situation. And a lot of what politicians are saying to you is like a straight up lie. And this is a great up resource for you to refer to when holding them accountable. Next slide, please. Speaking of lawmakers and politicians representing us, sadly, there was a vote held this afternoon. Democrats pushed for a bill that would be a clean extension of the tax credits for 3 years. And Republicans put up a bill that would eliminate these tax credits, continue to throw people off the cliff. So you'd still see your premiums hike an average of $1,000. And then on top of that, they would, when the value of your tax credits was $6,700, they thought putting $1,000 for you in HSA, which by the way, HSAs are mostly used by the rich as a tax haven. Most middle-class families can't afford enough money for their premium and then their deductible and then extra money to keep and save aside in an HSA. Like that doesn't happen. But they think that the solution that was meant for rich people will somehow support the middle-class families who are struggling. So like if you look at the math behind the proposal that Senators Moreno and Husted voted for, they want to put $1,000 in an HSA and let that cover your health care for a year. The average premium just for like the cheapest and worst quality plan on the marketplace is on average $5,400. So it's not even going to cover like 20% of your premium for that year. On top of that, the deductibles for those plans are higher. So the amount that you have to pay out of your own pocket before health insurance coverage kicks in is even higher for those plans. It's $7,500 on average. So they want to take away the healthcare tax credit that would get you a lower premium or lower deductible plan with better coverage, lower copays for everything, and stop you from having that at a decent price, and instead just give you $1,000 of pity money that you'd blow out way before you reached your deductible, and like is way less than what would see you through even one hospital stay. Like one car accident, one broken leg, it wouldn't even take care of that. So sadly, that is what Senator Moreno and Senator Husted voted for, rather than extending these tax credits for 3 years and giving Congress the time to look for a solution that lowers overall healthcare costs and takes care of the issue and would be a sustainable solution. And so, yeah. So we are where we are. Our politicians voted how they voted. And let's take a look at what's happening on the ground. Hundreds and thousands of Ohioans are already feeling the pain. Nearly 600,000 Ohioans are getting their healthcare insurance on their own through the marketplace. And on average, they'll pay $700 more each year for their health insurance because of this, which is really steep in this economy. And for plenty of folks, especially seniors who are nearing that Medicare age, but they don't quite qualify yet, we're seeing their premiums triple. We're seeing seniors having to pay, like a 60-year-old couple having to pay $3,000, $4,000 a month for healthcare. And who can afford that? That's like a mortgage or 2 mortgages. And an estimated nearly 500,000 Ohioans will lose their health care thanks to the big ugly bill overall. Between these cuts and the Medicaid cuts, a lot of folks are going to lose their health care. These are a couple of examples of how different demographics might be hit and see their premiums rise. And also, lastly, thanks to these premiums hiking and people not being able to afford healthcare, not being able to afford to go into a hospital or clinic, hospital and clinics in Ohio are going to struggle. And just from the loss of these tax credits, they're going to lose over $360 million in funding. So again, it's going to add to the shuttering that we're seeing of clinics and hospitals across the country. Okay, now this is probably a really important slide for anyone who is navigating buying healthcare on their own through the marketplace. I'm just going to go through firstly a couple of dates to remember that are really important. And first of all, if you haven't already, I really encourage you to log on to healthcare.gov before December 15th. So log on tonight, or you have 3 more days. But please do that, because December 15th is the deadline for you to enroll in a plan for the plan to take effect come New Year. So it's really important that you remember that. Also, you want to make sure that you log on to the marketplace, even though you are set to be automatically re-enrolled, because these premium hikes are going to hit you. You do not want to be caught off guard. I know that sometimes, like with my energy bill or different bills, I almost like don't want to look and I just put it on auto pay. But this is something that you do not want to put on auto pay, because you're looking at potentially $1,000 of more in premiums. And when that first bill hits, it's going to hit hard. So don't get stuck in your old plan, because you might find that the price has doubled or tripled. So please go log in, brace yourself, and then find a plan that will work for your budget and works for your healthcare needs, or like is the best of all the terrible options, because I know it's going to be difficult. But like, here are a few pointers on finding the best healthcare for you. And hopefully we can be all optimistic about Congress finding a solution in the meantime, although I will say time is running out, and the chances that any solution could be enacted quickly enough to take effect January 1st are slimming greatly by every day. And so when you're logging onto the marketplace, you're seeing that your premium has doubled or tripled, and you're thinking, I simply cannot afford the healthcare plan I had last year. Here are a couple of things you want to do. First of all, when you're enrolling in a plan this year and going through the whole process of registering on healthcare.gov and you're putting in your income, you really want to make sure that you are accurate about your income, because starting next year, when you're filing your taxes, you could get a very unexpected tax increase if you underestimated your income in any way. And before this bill, people with lower incomes were protected from the government coming and clawing back through higher taxes because if they estimated their income wrong. But sadly, now even low income individuals, if there is a difference between what you estimated your income to be and what it ended up being, the government will hike your taxes accordingly without any limit. So you could see, say you forgot that you were auto re-enrolled and your plan price goes up by 3,000 or something crazy, and then you had underestimated your income and you lost your tax credit because of your new higher income, then all of a sudden you'd see like a $10,000 additional fee when you go to file your taxes. So like this is a very real danger, and you want to make sure that you estimate your income accurately, especially if you're making near 400% of the federal poverty level, which is like, say you're a couple, that's about $85,000. Say if you're a family of four, that's about $130,000. And say if you're an individual, that's about $60,000. So if you're near that income, please make sure you try to estimate your income as accurately as possible. I know it's much harder for people who are gig workers or seasonal workers, but do the best that you can. Secondly, you want to assess your health needs. If you have moderate health needs, a silver plan may end up being more cost effective for you because you have your premium, which is the amount you pay every month, which is the amount that's probably going to give you sticker shock. But the way that some of these lower quality plans will get you, such as the bronze and catastrophic plans, some GOP proposals are trying to push people into, those plans have a higher deductible. So even though you're paying a lower premium, the amount that you'll have to pay out of pocket before your coverage kicks in is much higher. And then you're also potentially looking at higher co-pays when you need to see specialists and everything else. So if you need a lot of healthcare, I would consider sticking with the silver plan because it may lower your overall cost, but you want to take into account that deductible and what the co-pays would be looking like and how much healthcare you think you'll need. And you want to make sure that your doctors are in network and make sure that your prescriptions are covered. So the two things you definitely want to do. I know all of that's extremely complicated. Luckily, there are people who will sit down with you, talk on the phone with you, and walk you through this whole process. And they're called navigators. And you can go to Get Covered Ohio, and they're a great group that can help you with navigator assistance. Yeah. So I know that was a lot, and I'm probably talking a whole bunch. So if we could go to the next slide. Lastly, how you can get involved. So first of all, like given all this information, I hope that you'll call your senators and tell them how you feel. And if you can't reach them, leave a voicemail. Tell your local newspapers what's happening to you after you see your premiums, write in. And even send a screenshot. Like when you log into healthcare.gov and you're looking at how much more your plan is this year, send screenshots of like what your plan was in 2005 and what it is in 2006, and send it to your senators, send it to your reps. And lastly, we have a state team in Ohio. They're always putting together events and trying to get the media's attention on this so that Congress will pay attention. And we need more people who have been impacted by this to speak up. So please reach out to us. And that is it from me. I know I went on for a long time and I apologize.
Uh, no apology needed. I did not overstate at the beginning how lucky we are to have you join us. That was incredible information. And I just want to say, Vashu, this is scary stuff. Like this is not normal. You know, this is not normal. This is a crisis that has been wholly created from legislative policy. And I just want to thank you for the information, but also walking us through the what to do. Because so often we can tell you the facts and figures, but then being able to help someone, okay, how do I mitigate this in my life? What is the next best step is a little harder, and you really delivered on that. So I appreciate you so much for doing that. And I just encourage the folks out there today listening. Again, you will get these materials. If there's someone you know who's one of those people, possibly like I would be, that's just like, ooh, I don't want to, gosh, this seems really tricky and hard, and I don't want to face it and don't even know where to get started. Share Vaishu's materials. Let them know the navigator number, those key dates that are going to come up, and just try to encourage yourself or others to try to get ahead of it and to tell that story. Right. I love that idea of taking a before and after and letting Ohio senators know exactly what those consequences are. Policy Matters would be glad to help folks out there if you want to figure out how to do that, if you're interested in a letter to the editor, if you want to just have a conversation about your experience. We really value those stories and that story sharing. Of course, Protect Our Care is going to be there to support and encourage you all in the same way. So absolutely incredible. And honestly, it just breaks my heart because all of this would be avoided. The federal government had a chance to correct this in the big, beautiful bill. They could have corrected it during the government shutdown, could have got it done then, could have done it today. There's still time to avoid this, and hopefully that will not be lost on our representatives. But my goodness, it is absolutely true that policy matters. This is no clearer demonstration, for good or ill, the policy decisions that our elected uh, officials are making show up in our homes and in our lives.